Chapter 40, Terrorism, Response, and Disaster Management. It may happen at some time during your career that you may respond to a terrorist event or even some kind of natural disaster in your area. It's difficult to plan or anticipate for these types of responses, especially for terrorist events, because by definition they are unannounced. So it's hard to be prepared. But there are some things that we can apply with every response that will help us to mitigate these type of situations. What is terrorism? Terrorist forces have been at work since early civilizations. They involve violent acts that are dangerous to humans, that are volatile to the federal and state government. They're designed to intimidate and coerce the population, and they affect the conduct of government by mass distraction, assassination, or even kidnapping. There is international terrorism, which we have seen affected the effects of on our nation, such as the Twin Tower bombings in 2001. We also have domestic terrorism, which is typically within the United States, perhaps by terrorist organizations that are organized within the United States. An example of that was the Alfred P. Murrow building in Oklahoma City. Some are religious groups that are extreme, some are doomsday cults, cyber terrorists. The list can go on and on. Suffice it to say, we are all affected by terrorism on one level or another. Sometimes they use weapons of mass destruction to cause the maximum amount of damage, death, casualties, etc. They can be of nuclear in nature. They can be bombs, such as the fertilizer truck or the Ryder truck that was filled with fertilizer at the Oklahoma City bombing, at the Alfred P. Murrow building. These are some of the mnemonics that we can use for weapons of mass destruction. Typically, explosives are the preferred weapon of mass destruction. But sometimes they use chemical agents that can cause blisters, they can cause respiratory choking, nerve damage, they can certainly cause death. The challenge with terrorist activity is they don't fight by the typical rules of war or typical rules of engagement. So they use chemicals or whatever type of weapon that they can get their hands on. Some of them are viruses, bacteria, toxins. They infect, sarin gas, and some other diseases that were once thought eradicated. For example, smallpox can be weaponized. Nuclear and radiological terrorism, certainly something that in the Pacific Northwest we think about. The proliferation of nuclear vessels with nuclear warheads, dirty bombs, which is spent nuclear waste product. We have a nuclear waste site in Washington State, so these are not out of the realm of possibilities within our area. So what do we do? What is our function in a terrorist response? Well, our basic function is to take care of the patient. There are protocols that are in place should we be responded to a terrorist activity, whatever the nature of that might be. And ultimately then, thinking back to the incident command system, who's ultimately in charge? Well, that would be more than likely the Department of Homeland Security. The National Terrorism Advisory System is also going to be alerted, and they will come and they will help mitigate the situation also. So on every call that we go on, whether it's terrorism or not, we need to keep things in mind, these things in mind. What is the location of the call? Like what building, what type of building, what place? What is the nature of the call? How many patients are there? What are the patients telling us? What are the indicators that we see that could give us an idea of potentially more damage or problems or need for more resources? Scene safety, of course, is paramount. Always wait for law enforcement in a suspected terrorist activity. Um, our job would probably be to be staging at a location outside of quote unquote the hot zone and have patients brought to us. Our response actions, for example, in this picture, we see a tanker truck that is turned over. What's the contents? You can see the placard, but there are no visible numbers on the placard in this illustration. Is this ambulance properly staged and parked in a way where it's safe? Is it downhill or is it uphill, upwind, away from any potential hazard? Do we have the right protection when working in that area, in the hot zone? Responder safety is always paramount. The greatest threat facing you and a weapon of mass destruction is becoming contaminated or cross-contaminated with whatever agents may have been used. Notify the dispatcher of the nature of the event, require any additional help that is required, estimated number of patients, and if we believe that there may be some type of weapon of mass destruction being used. And of course, notify the pertinent additional authorities. Establish command. If you're the first ambulance on scene, you're going to be the mobile incident commander until somebody else shows up. What are your thoughts? What things are running through your head? Have you looked at your MCI plan lately? Have you reviewed the different branches, the medical branch, the triage, treatment, transport, etc.? At least have those things running through your brain. Reassess the scene for safety. Some of these scenes are going to be very dynamic and they're going to be fluid. We need to make sure that we're always safe. Don't just go into any scene and think, oh, it's at a house, everything's great. We should always be making sure that it's safe for us to be there. In the presence of chemical agents, what kind are they? Are they liquid or gas? Can they, what is the volatile nature of it or non-volatile? This is where looking at our emergency response guide will help us. And when in doubt, stage. Don't go into the scene. Has the gas vapor, is it a vapor hazard? Is it going to get in the air around us? How far is it going to carry? What are some hazards that we need to keep in mind? Does the personal protective equipment that we carry or we have with us, is it going to work? Is it going to be enough? These type of agents, viciants, are they come in primary contact. They can cause burns, respiratory tract problems if breathed in. Um, so look for those things, blistering and hoarse voice and that kind of stuff. Examples, sulfur or mustard gas. We saw how this was used in World War I, and it's a very effective weapon of mass destruction. Um, and as soon as you breathe it, or as soon as you smell it, it's too late. Some other gases, phosgene gas, small blister wounds when it kind of when water's added to it, it becomes even more toxic, um, turning your lungs into sulfuric acid. So pulmonary agents, of course, are the agents that get into your pulmonary system. So the primary route is through the respiratory tract. So do we have the proper protective equipment for us when we're taking care of our patients, or when we're at staging, or wherever it might be? Chlorine gas, um, again, a common chemical that is used um, often in like industrial use for like swimming pools and such, but has been used very effectively as an agent of warfare. And you'll find that many agents can be weaponized. Again, we talked about phosgene gas, um, and it is bad. Nerve agents. Some nerve agents are used in warfare. Um, Mustard gas, again, kind of falls into that, can be a nerve agent. Anticholinergics or cholinergics, that can be used for like fertilizer. Um, they can cause significant damage to the sympathetic nervous system. Here's some examples of that. Sarin gas may be one of the ones that might be most commonly recognizable on this chart. So with nerve agents, we think of the acronym sludge or dumbbells. Remember salivation, lacrimation, urination, defecation, drooling, diarrhea, gastric upset, gastrointestinal distress, emesis, and then muscle twitching. Those are classic signs of organophosphate poisoning, which is typically what some nerve agents are made from, organophosphates. So if your patient is essentially leaking out from every orifice and just super wet, think about that, and that's where the atropine and 2-PAM chloride is the antidote for that on the ALS level. Hydrogen cyanide smells like bitter almonds. Again, it's one of those cyanide. Um, for in particular, if you smell it, it might be a little too late. Dizziness, lightheadedness, but it can also come in different forms, where cyanide gas may not be necessarily deadly, but certainly will make you feel bad. Anytime wool burns, it produces cyanide gas. Other biologic agents that may be available and used in a weaponized manner. Um, they can be completely undetectable because, again, they're a virus or bacterium, such as I mentioned, smallpox. And then by the time that you are infected, it's like, um, it's too late. They sometimes can easily be spread. They can be weaponized. They can be put into the air. Um, and then before you know it, hundreds, even thousands of people are affected. Viruses, we have some familiarity with the viruses and how they work. They invade healthy cells, they replicate themselves inside those cells, moving throughout the host and causing some significant damage to the host, up to and including death. And they move from person to person by different things called vectors. Here's an example of what smallpox looks like. Certainly a horrific disease. So taking care to wear the proper protective equipment when examining somebody, a HEPA filter mask, filter respiration, maybe an N95 or N100 mask, depending on what you have. Certainly a gown, gloves, safety glasses. Again, some of the ways that these can be spread, aerosolized in warfare. They can be person to person, and notice the signs and symptoms: fever, malaise, body aches, headaches, and the classic blisters. We also have viruses that can cause hemorrhage, viral hemorrhagic fever. Patient presents with flu-like symptoms, progressing to more serious symptoms such as internal bleeding. Somebody's leaking out their eyeballs, um, blood. That's certainly a bad sign. Always take proper protective precautions, PPE. Again, dissemination is mostly through direct contact, but it can be aerosolized. So, bacteria doesn't require a host to multiply and live. Certainly more complex than a virus. They can grow bigger, um, but typically antibiotics will help eradicate them. Examples of that are anthrax. Now, when I said can help eradicate, it doesn't necessarily mean it will. It can certainly slow it down. But remember, there's a lot of bacterium that is developed mutations that are resistant to antibiotics. So, anthrax certainly is one of the most deadly bacterial agents, weaponized agents that is known at this time. It's aerosolized, um, flu-like symptoms, fever, respiratory distress, and of course the plague. Um, of course, right now, those of us who are under quarantine or stay-at-home isolation because of the coronavirus COVID-19, we certainly feel as though this is a type of weapon of mass destruction almost, but remember, this is different. It hasn't been weaponized. So, but the plague is, carried by critters, rodents, fleas, insects. The bubonic plague, for example, was attached to the lymphatic system. Um, the pneumonic plague type of pneumonia that got into people, and these were just horrific. Um, they may leave lesions or marks, illustrated in these photographs here. Typically, the bacteria can be aerosolized. Bubonic plague was only from person to person, but with so many people uh, contracting it, certainly became a pandemic rather quickly, um, much like the COVID-19 became a pandemic very fast because of how many people had contracted it. Neurotoxins, probably the most deadly substances known to man. They can be produced in plants and marine animals, molds, bacteria. They're you know they're just kind of everywhere. Um, the common protection for certain types of animals is a neurotoxin. Um, if we come in contact with it, of course, the results can be devastating. Um, botulinum toxin or botulinum can be a type of neurotoxin produced by bacteria. Voluntary muscle control diminishes, um, eventually becomes toxic paralysis, leading to respiratory failure and perhaps death. It can be aerosolized, can be added to food supply, as a form of sabotage, and can cause some. Certainly, the end result would be devastation and death if it's used as a weapon of mass destruction. Ricin, another neurotoxin, derived from the mash of castor beans. It's amazing how something that seems simple is like that we could use to eat is fermented and then used as a weapon. Um, but notice the causes of it causes pulmonary edema, respiratory and circulatory failure, and leads to death. Super extremely toxic. It can be released indoors or outdoors via aerosolized canisters. People can fashion these in all kinds of things. I read an article where they were using ricin um, to they would make ricin in old they'd make a aerosolized bomb, excuse me, in an old fire extinguisher. Um, just set it up there and then put it in a building. Or for a while, there were some terrorist groups that were attacking mosques, and they were using ricin. So, other rules for the EMTs is, we're going to be helping out as best we can, surveilling the scene. We're going to be um, looking at patients. We're going to be looking for signs and symptoms. Anything that resembles influenza is important. Anybody who's having breathing problems, those kind of things. Again, if we have the flu in our home, it's usually one person is sick and then they get better, and as they're getting better, the other person gets sick. Um, when everybody's kind of getting sick at the same time and they have the flu-like symptoms, that kind of stuff, those usually are caused by other outside influences. So it should start sending up like little red flags in our head. Try to find the points of distribution. We're going to have, as the rules of EMTs, we're going to be setting up checkpoints, if you will. One person in, one person out. We may be distributing antibiotics or antidotes as the situation and the circumstances dictate. We'll be working with the Center of Disease Control, CDC, and doing everything we can to push back this activity wherever possible. Remember, always wear the proper PPE. Radiological and nuclear devices. We've talked about this earlier in the class, the different types of radiation rays that are most damaging to the human, alpha being the least harmful, and then neutron particles being the most harmful. If you respond to one of these, some training that I've done over the years, we had a big mass disaster drill with the military and the Department of Emergency Management, and pretty much gave us the idea that if we get exposed in one of these, dirty bomb kind of things, that we're going to be sick for a really long time until we die, and we're pretty much not going home again. So, but who knows? Those are some things that you kind of think about, though. Not that I want to scare anybody, but terrorist activity isn't just effective when they blow stuff up and kill a bunch of people. Terrorism is effective every day because of the threat and um, how people think and what they think might happen. And these nuclear devices and radiological devices seem to be even more scary because, as they say, you don't see them coming. So here's an example of the different types of rays that and how they might react to what we can do to help prevent them. Once the radiological material has been used, the remaining stuff is called radiologic waste. We call it nuclear waste. whether it's in a hospital or a nuclear power plant or nuclear power plants on warships, which we have in the Pacific Northwest in Washington State, several nuclear powered facilities, or military for primarily. Uh, the waste can be used as a weapon. We've talked about this. The material can be used as a weapon. They can weaponize it, put it in a bomb, and then it's just, the destruction can be devastating. Nuclear energy is artificially made by splitting atoms, um, and creates a great amount of energy. It's used for positive things, such as medicine. Nuclear medicine and radiation is used to help treat cancer cells by helping destroy those. It can be used in weapons that help protect our nation and our way of life, power plants, nuclear naval vessels. But like a lot of things, in the wrong hands, or it can be used as for bad things too, clandestine activity. Nuclear weapons are kept in pretty secure facilities, and I like. We know that there are submarines in our area that have nuclear weapons on them when they are out to sea. Um, we also know that they are kept under, as you say, a lock and key. Um, and some of you have served in the military who are hearing this and seeing the slide program certainly know way more about nuclear weapons than I do. But they're hard to get to. People who are exposed by excessive amounts of radiation uh, will be considered acutely toxic to that, to have had a toxic exposure. Um, and it kind of depends on the type of radiation and how long they were exposed to it as to what really the long-term effects are going to be of that radiation. Here we can see some of the exposure rates. If it's low exposure, it might be nausea, vomiting, diarrhea, headache, that kind of stuff, up to and including second and third degree burns. A person could get cancer um, as a result of that, and die. Being exposed to radiation um, does not make the patient contaminated or radioactive. It means that they were exposed. So wear a proper PPE um, and take them to the proper facility where they can be evaluated and treated appropriately. There is really nothing available that will completely shield us from any radiation. But if we do our best, a lot of radiation um, that we're going to come in contact with, particularly like the alpha radiation, our regular street clothes or uniform, gloves, safety glasses, they'll do a pretty darn good job of protecting us. And then it might be that the person has to go as far as having a level A hazmat suit. There are other devices, incendiary or explosive devices, pipe bombs, um, dynamite, just plastic explosives, all kinds of things. Um, they and then of course it's not just that; it can be all kinds of clandestine uh, bombs that are made of. Like I mentioned, the um, Alfred P. Murrah building bombing in Oklahoma City was used with a truck that was filled with fertilizer, and then there was you know a, a device to set it off. Keep in mind that this would be a blast injury, so there's a primary blast, which is going to severely affect the people who are within close proximity of that. And then there's the secondary blast injuries, the injuries from falling objects, from um, flying debris, shrapnel, and then of course the injuries in the person themselves or things falling off of buildings, etc. Think of back to our blast injury lecture that we had. So, what are some of the physics of an explosion? Well, a substance is detonated, a solid or liquid chemical converted into gas under high pressure, and it goes boom. This generates a spherical blast wave, and sometimes they add stuff inside of it to make it more um, deadly. Um, for example, pipe bombs will have built into them shrapnel, nails, screws, whatever it might be, that can fly and then cause more damage. The hollow organs and middle ear and GI tract are certainly going to be affected by the shock waves because they're not designed for that, and they're going to, it could rupture, it could be severely damaged. Lung injuries are the most common, kind of a pneumo, get superheated gases into your system, all kinds of things. Um, Suffice it to say that incendiary explosive devices, weapons of mass destruction, and terrorism are scary. It's important that you are aware that these um, activities could be a call, a response that you go on someday. But as I mentioned earlier, um, terrorism is a crime of fear. I mean, in my opinion, and with all the other stuff that we talked about already, don't allow your fear to cripple you. If you are called on to respond to one of these types of events, be professional. Keep your head about you, keep your wits about you, do your job. That covers this information. Um, Please, as always, let me know if you have any questions.